I'm Jlyn Pritchard. I'm one of the providers at Vivacity Care Center. The team asked us to put together a little get to know you video. So this is your opportunity to get to know us a little bit better. My mindfulness and wellness routine looks very chaotic. I typically am up by 5. I try to fit in a 20 to 30 minute workout, but it often is interrupted by kids. And my morning kind of unravels from there typically. I usually glug a couple of cups of coffee on the way to work, and typically by the time I finish my last sip, it's cold and about 3 p.m. But I do tend to enjoy waking up early because it does make me feel a little bit more grounded. I would for sure describe myself as an introvert. A very, very much an introvert. I need silence and solitude to restore and rejuvenate myself. We live on about 5.5 acres, so I can go walk the trails in our backyard, and I do feel rested and restored when I'm outside in the garden. However, it's really hard with 3 kids, and if any of you are introverts and are moms, it's hard to be a parent and have 3 extroverted children running around. My tendency toward being an introvert has come in quite handy during COVID, but generally speaking, it does make it a little more difficult to find solace with my kiddos. I would have to say that I would be the bad guy from Ratatouille because he just gets to eat all the time, and who does not want to do that? I try to live, there's my husband. I try to live a life with myself and my family that is very reflective of what I try to teach to patients. And that means that I try to cook meals with whole foods. We try to force our kids to eat broccoli and carrots and all of their green vegetables. We really try to stay active. I'm excited to meet more people, and I'm excited to kind of learn from people, learn together. I always learn from my patients. I hope that in 6 months, our clinic, because we'll have more than one location, we'll have the opportunity to really get to know the people of Spokane better. What are your needs? What are your wants? What are your desires? What are your goals? How can we help you? Because at the end of the day, that's what I'm here for. That's what my job is. But my main goal for most people is to try to develop a relationship with them and develop a clinic that they feel at home at and becomes a place that feels clean and homey and welcoming, because most of us have a lot of changes to do, whether that be mental or physical, and we have the tools to help you with that. I love it. Lydian, can I ask you some questions?
Are you hungry, baby?
Where are you going? I sat down to ask you questions.